Let's continue our discussion on the accumulation of the Xi-Cleft points with GB35, also called the Yang intersection point. GB35 is located 7th June proximal to the highest prominence of the lateral malleolus on the posterior border of the fibula. So how to find GB35? Using the quick method of spreading hands technique, locate GB35 at the midpoint of a line connecting GB34, which is in the depression anterior and inferior to the head of the fibula, and the highest prominence of the lateral malleolus on the posterior border of the fibula, which has a total distance of 14 June. GB35 is located 7 June proximal to the prominence of the lateral malleolus. Another method, still spreading hands technique. Locate GB35 1 June distal to the midpoint of a line connecting the popliteal crease and the highest prominence of the lateral malleolus on the posterior border of the fibula. This is a total distance of 16 June. For orientation, the borders of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the posterior border of the fibula just superior to the lateral malleolus and then locate the point on an imaginary line running to the head of the fibula. Located on the same level are GB36 on the anterior border of the fibula and bladder 57, which is 7 June proximal to bladder 60. Bladder 35 is needled vertically 0.5 to 1.5 June. Its actions and indications include clears heat, opens the channel, and relaxes the tendons. It also regulates Qi of the gallbladder and calms the Shen. Special features, it is the Xi-Cleft point of the Yang Wei Mai, the meeting point of the Yang Wei Mai according to some authors. GB35 is mostly used in acute pain along the gallbladder channel with stiffness and cramp of the leg muscles. As the accumulation or the Xi point of the Yang linking vessel, it affects the Yang channels of the leg. It removes obstruction from the channel where there is swelling and pain of the knee, painful obstruction syndrome or the B syndrome, and atrophy or the Wei syndrome of the leg, cold painful obstruction syndrome, fullness and distention of the hypochondrium, and lateral costal region. This point is mainly used for acute pain along the gallbladder meridian with stiffness and cramp of the leg muscles. It coalesces with the Yang Wei Mai, thus reinforcing the gallbladder meridian influence over the lateral costal areas and neck. The role of the Yang Wei Mai in regulating the yang supports the gallbladder's ability to calm liver yang rising, which manifests with emotional lability, tinnitus, deafness, and confusion, and balance stagnation or deficiency of both gallbladder and liver, which will manifest with fright, distension, and pain in the chest, asthma, feeling of obstruction in the throat. Gallbladder fright can affect the heart protector and heart as the gallbladder divergent meridian passes through the chest and connects with PC1. This can lead to anxiety or palpitations, or if heat is also involved, to Shen disturbance in manic behavior. So to highlight these points functions, it regulates gallbladder, it relaxes the sinews, it eliminates wind, removes obstruction from the channels. It is the local point for swelling, pain, and cold of the lower leg and foot. It is a special point for neuralgia or pain following the gallbladder meridian, especially neuralgia or paralysis of the tibial area. It relaxes the sinews, especially around the knee and lower leg. It helps with clarity of vision where the patient is confused or muddled in the mind.